Chapter 37 discusses thyroid and parathyroid drugs. The thyroid gland produces two thyroid hormones using iodine found in the diet. The body removes iodine from the blood, concentrates it, and prepares it for attachment to tyrosine, an amino acid. Therefore, you need sufficient iodine intake to produce thyroid hormones. Levothyroxine is T4 and liothyronine is the T3 hormone. You see on table 37.1 on page 613 the signs and symptoms of thyroid dysfunction, and I have given you a few of the main symptoms of both conditions here. Note that if I am replacing someone who is experiencing fatigue, lethargy, dry skin, cold intolerance, weight gain related to hypothyroidism, and I give them too much levothyroxine, I'm going to have symptoms of hyperthyroidism, which include the adverse effects of this drug: tremors, headache, nervousness, palpitations, tachycardia, etc. Because as I over-replace the drug, I'm going to have symptoms of hyperthyroidism. Also note that you need to take thyroid medications with a full glass of water to avoid issues with difficulty swallowing and esophageal atresia that can occur with this drug. So you take the drug in the morning with a full glass of water 30 to 60 minutes before or 2 hours after you eat your meal. You need some caution with a lot of conditions, and you need some caution with a lot of drugs because the absorption of these drugs is changed with the replacement of the thyroid hormone. Antithyroid agents include the thiamides, or propylthiouracil, or PTU. PTU inhibits the synthesis and release of thyroid hormone into the circulation and is used as a therapy for hyperthyroidism, where you want to stop that action and stop that release of thyroid hormone. It can also be used as a thyroid blocking agent in radiation emergencies. There are many side effects for the use of PTU, including hepatotoxicity, nausea and vomiting, aplastic anemia, and bleeding. This drug is often given as a liquid and it will stain the teeth. So patients should be taught to drink this medication with a straw in order to avoid that teeth staining. Okay. Sometimes the drug can lead to too much blocking of the thyroid gland, so the patient can exhibit hypothyroidism. And they can also exhibit goiter and swelling of the salivary glands. This drug is given 3 times a day at the same time in relation to meals. So food can either increase or decrease its absorption. Therefore, if you give it the same way every time, then it's easier to regulate the amount of PTU that you need. Patients need to report signs of infection and headache, yellowing of the eyes or skin, which would mean that the patient may be developing hepatotoxicity, bleeding or bruising, and any symptoms of hyper or hypothyroidism, indicating that the amount of drug the patient is receiving is not the correct amount. Another antithyroid agent is strong iodide solution. You find this on page 619 and 620. This inhibits the release of thyroid hormones and decreases the vascularity of the thyroid gland. It is used as a prep for thyroidectomy, to treat a thyrotoxic crisis, and as a radiation protectant after a radiation emergency. Again, you're going to have some of the same side effects as you do with the thiamides. And in addition, you can develop a condition called iodism, and that I have information on at the bottom of your slide, and we'll get to that in a few minutes. This drug is an oral solution, and it must be drunk through a straw to avoid teeth staining. Can be mixed with a full glass of water or juice and it is to be administered after meals because it does tend to upset the stomach, so that decreases those side effects. The next set of drugs are the parathyroid drugs, and they include the antihypercalcemics and the bisphosphonates. The bisphosphonate example that we are using from the text is alendronate. It is used to block or slow bone reabsorption, keeping the bone stronger. So it slows normal and abnormal bone reabsorption, but it does not stop bone from forming and mineralizing. It is used in the treatment and prevention of osteoporosis, particularly in postmenopausal women who no longer have that estrogen that is an important part of building bone. It can also be used for osteoporosis in clients who take glucocorticoids, and can be used, alendronate is the approved drug for men who have osteoporosis and can be used in Paget's disease. The signs and symptoms include a headache and increased or recurrent bone pain, which makes sense if you think about the fact that you're changing how bone reabsorption and formation occurs. This drug is very caustic to the esophagus and can cause esophageal erosions. Therefore, you must take it in the morning with a full glass of water and remain upright for 30 to 60 minutes after taking the drug. If the patient cannot comply with this, then this is not the drug of choice for them. If the patient has hypocalcemia, this drug is contraindicated, and you have to be cautious with patients who have upper GI disease like GERD or who have renal insufficiency. There is a decreased absorption of the bisphosphonates if they are taken with antacids or calcium products, so you have to be careful to avoid those combinations. There are many other drugs that are used to treat osteoporosis, and you will learn some of those in 491 when you are taking that course and you talk about the orthopedic section. The final drug in this section are the antihypocalcemics. Calcitrol is the drug that we chose to highlight here. It is commonly used vitamin D compound. It regulates absorption of calcium and phosphorus, and it helps to increase the calcium levels. You find this on 625 and on 626. It manages hypocalcemia in patients on renal dialysis and hypocalcemia associated with hypoparathyroidism. It does stimulate new bone formation, can have many side effects including muscle and bone pain, constipation. It will leave a metallic taste in the mouth often. So patients who take these drugs also have GI side effects. You need to monitor the calcium levels, look for signs of vitamin D intoxication, and to keep the dietary calcium consistent to avoid a sudden increase in calcium levels in the blood. There are many drug-drug interactions, including digitoxicity. I have listed the signs of iodism, the metallic taste, burning in the mouth and throat, head cold symptoms, sore teeth and gums, as well as the signs of vitamin D intoxication listed here on your chart. If you have learned these drugs and you have looked at the clinical case study in your chapter that is talking about hypothyroidism, that will be very helpful to put this in a patient scenario for you, as well as looking the gender considerations for osteoporosis will be helpful for you. You will learn more about these disease conditions in your med-surg courses next semester, but at least you will have an introduction to the drugs that are commonly used for them here. Thank you.